Welcome to Inside 340B Report, an insightful conversation between 340B Report's editorial team on the key issues affecting the 340B drug discount program, the nation's second largest government drug program. Hello, and welcome to the latest episode of Inside 340B Report. I'm Ted Slafsky, publisher and CEO of 340B Report, and I'm joined today by Shannon Young and Will Newton, who are associate editors and senior writers at 340B Report. We're also very excited to be joined by Luke Zarzecki, our new national correspondent, who is joining us for his second episode. Before we dive into the latest 340B developments, I want to let our listeners know that we're pleased to offer a special 25% discount to 340B Report for first-time subscribers. You can go to the subscribe tab at 340breport.com and use the coupon code podcast25 to take advantage of the discount. I know you will find our news service to be a valuable investment. I also want to encourage you to check out 340B Report's business-focused podcast, 340B Leaders Up Front, hosted by Anna Mangum. The podcast showcases conversations with industry executives who are at the cutting edge of innovation and leadership in the 340B space. Today, we're going to discuss a new House bill that would protect community health centers from 340B rebates, a continuation of an investigation in the U.S. Senate into the 340B program, what some members of a Senate bipartisan 340B working group have said about the rebate issue and their long-awaited reform legislation, and a major new development in the hospital lawsuit challenging HHS rebate pilot. We're also going to talk very briefly about a newly enacted federal spending bill and its 340B implications, and we'll do a quick look at the state action. There's a lot of activity already going on in our state capitals throughout the country. Let's start with the new House bill. Shannon, you recently broke the news about this bill. Can you tell us more?
Yeah, so after what seemed like a couple of quiet months on Capitol Hill in relation to 340B policies, we had Congressman Jack Bergman, who is a Republican from Michigan, and Jake Auchincloss, who is a Democrat from Massachusetts, introduced a bill on February 5th called the Community Health Center Drug Pricing Protection Act that would exempt federally qualified health centers from any proposed 340B rebate model. And so the bill comes in response to drug makers' efforts in recent years to implement 340B rebates, including through HRSA's currently halted rebate model pilot. And specifically, it would prevent the HHS secretary from entering into an agreement with a drug manufacturer in which the amount the FQHC would have to pay for a covered outpatient drug exceeds the 340B ceiling price. And it also clarifies that nothing in this law, this or new language, should be construed to allow rebates under other arrangements not put forth by the secretary. So that's a really wordy way of saying it's trying to prevent community health centers, federally qualified health centers, from having to be subject to any drug maker rebates, regardless of how they're proposed. And noteworthy, it doesn't include hospitals, who, as you may remember, are the ones that sued over HRSA's rebate pilot. 340B providers across the board have been pretty vocal in their concerns about switching 340B from a upfront discount to a back-end rebate. And so it's going to be really interesting to see how hospitals respond to this bill. Now, I do want to note that this is the first bill in what is at least going to be a two-bill series to enact these type of protections. Both Bergman and Auchincloss are working on another bill that they haven't introduced yet that would apply similar protections to 340B covered entity types that include like critical access hospitals, sole community hospitals, Ryan White clinics, and a few other providers, but not these main big hospitals. And I feel like that's sort of an indication of where things stand in Congress right now. There's a lot of appetite to have these conversations as it relates to certain types of 340B providers. Whether hospitals can get their foot in the door there will be interesting, but something that we'll definitely keep an eye on.
Thanks for that, Shannon, and super cool that you're able to actually break that story and get the full bill text before anyone else did. And also on Capitol Hill, Luke, I know that you spent several days there over the past week or so asking members of the Senate 340B working group about how they feel about rebates and also on the status of their very long anticipated bill. So can you tell us a little bit more about those conversations and what you learned?
Yeah, so the Sustain Act has been in the works for a couple of years now, and it's a bipartisan bill that addresses contentious areas of the 340B program. And in early 2024, a draft bill was released that proposed codifying contract pharmacy use, adding transparency measures, and increasing regulatory oversight for both providers and manufacturers. Other areas were not addressed, like the definition of a 340B patient, and the bill is widely considered the most likely piece of 340B legislation to gain traction due to its support from both parties. I asked lawmakers how 340B negotiations were going, with Democrat Senator Tim Kaine telling me he thinks that the 6-member working group believes the program should not switch to a rebate model. And he said the group is trying to do a reform that continues with the status quo of purchasing the drug at a discount rather than a rebate, and said that is one of the issues the group is working through. But Senator Shelley Moore Capito, a West Virginia Republican, said she didn't have an opinion on the HRSA rebate model pilot, but believes the 340B program needs reform. She talked about how important the program is to the hospitals in her state, but expressed concerns about the growth of the program nationally. And I also had a source tell me that cultural issues like allegations by conservative dark money groups that claim that 340B savings is funding gender-affirming care and abortion have crept into 340B negotiations. And that source said that Senator Mark Wayne Mullen, a Republican from Oklahoma, raised some of those issues, but his office did not respond to requests for comments. And as some of you who may be aware that I've been following this for a little bit, there have been many high-profile ad campaigns at the state level trying to tie 340B to gender-affirming care, including the placement of billboards in front of state capitals with contentious messaging. It is possible that this could have prompted the concerns, but we did not confirm that, and it is purely speculation. As 340B report readers may recall, many red states passed 340B protection bills last year, despite these ad campaigns. And Senator Jerry Moran, a Republican from Kansas, told me that he was not aware that social issues were a factor in the delay.
Thanks so much for the update, Luke. I know everybody's been really curious to see what's going on behind the scenes with the Sustain Act. So thanks for doing all that legwork for us. Switching gears, there was another major development in the hospital lawsuit that led to a federal court blocking HHS from implementing its 340B rebate pilot. Will, you've been covering this. What can you tell us?
Definitely. There was a very major development in which HHS formally withdrew its current 340B rebate pilot proposal and also agreed to some new procedural guardrails if it chooses to attempt to implement a different type of rebate model in the future. And before going into this a little more, to kind of step back and set the stage, as many of our listeners remember, HHS had been planning to implement a 340B rebate pilot program that would allow the manufacturers of the first 10 drugs selected for the IRA's drug price negotiation program, Medicare drug price negotiation program, to offer 340B pricing through a rebate model beginning January 1st. And then kind of at the very beginning of December, the American Hospital Association and a couple of other hospitals sued HHS, argued that this rebate pilot violated administrative law and also didn't really fully account for the potential harms on hospitals. Then just before it's supposed to take effect, a federal judge in Maine issued a preliminary injunction blocking it. A federal appeals court in Boston then allowed that order to stand. And then we kind of learned through court filings that at that point, HHS and the American Hospital Association had started doing a little bit of negotiating behind the scene, and HHS indicated that it was going to drop its appeal. The filing that happened on February 5th that we're referring to is really the first time that we got to officially see formally what those negotiations resulted in. And the first most important thing, as I said, is that HHS has fully scrapped its 340B rebate pilot. That means that it rescinded the initial notice announcing it. It rescinded all of the drug maker rebate plan approvals. So that is not going to happen. This iteration is not going to happen. It also, as I said, added a couple of guardrails should HHS choose to try and attempt this in the future, meaning that HHS, if it tries to implement another rebate pilot, it would have to basically start from scratch with an entirely new notice. It would have to open up a new comment period for stakeholders to comment on it. And HHS would have to give at least 90 days between the time it approves any rebate plans and the time the rebate plans take effect. This is a pretty big detail because, as you might remember, there was only about a month last time around between when HHS approved drug maker plans and when they were supposed to take effect on January 1st. And so that's a pretty big difference. Now, with all that being said, kind of the big question as we're following, what people in Congress are saying about rebates and what might happen next is, what does HHS do from here? And we already know from having spoken to some drug industry attorneys and provider attorneys that there's a consensus that, HHS and the drug industry are pretty unlikely to abandon their efforts to pursue rebates, particularly the drug industry, which argues that this is kind of the best way to comply with the IRA and ensure there's transparency. But, if HHS does attempt to do this again, obviously things will have to be different. And in addition to the procedural guardrails now in place that HHS agreed to, a really big difference is that HHS is going to have to take into account all of this previous lawsuit and really make sure that its administrative record reflects that it's taking more into account the potential harms to 340B providers. And that could result in any new effort HHS makes ultimately looking a little different than its first attempt at a rebate pilot. The other really big difference is that the IRA is now in effect. And if we think back to the initial debates about 340B rebates, it's important to remember that one of the main reasons that the drug industry and HHS said that we needed a rebate in the first place was because of the IRA's Medicare drug price negotiation program and complying with the overlap with 340B program. Now, back then, during the initial comment period, initial debate about it, it was all a little speculative. Sort of all the parties were arguing, okay, what might happen once the IRA takes effect? Now the IRA actually is effect. We do have some data there. And so, I'd expect the drug industry is going to argue that based on what they're seeing, that a rebate model is completely necessary to deduplicate between the IRA and 340B. And providers, on the other hand, are probably going to continue to argue that there are other alternatives like a neutral claims clearinghouse. So that's kind of a lot, but the main point is that the current rebate pilot is done, but the door is still open for HHS to try something else at some point in the future.
Oh, well, thanks for that. That's definitely a lot of new information. Before we continue, let's take a moment to hear from one of our great sponsors.
Vital One, formerly Maxor, is the nation's only independent, fully integrated total pharmacy solution partner. By combining pharmacy operations, 340B management, specialty pharmacy, pharmacy benefit management, and patient affordability solutions, Vital One is dedicated to helping mission-driven hospitals and healthcare providers improve outcomes, unlock revenue, and reinvest in healthier healthcare communities. Learn more at www.vitalone.com. That's www.vytlone.com.
Congress recently approved a spending package that President Donald Trump this week signed into law. Shannon, can you tell us more about the spending package and its healthcare provisions, specifically related to 340B?
Yeah, so we discussed this a little bit in our last episode, so I'm not going to get too in the weeds here. But as Ted mentioned, Donald Trump, the president, on February 3rd, signed a $1.2 trillion spending bill that funds most federal agencies through September. It ended a partial government shutdown that briefly furloughed the Office of Pharmacy Affairs staff who oversee 340B. The package contained $116.8 billion for HHS and $8.9 billion for HRSA. And that included about $12.2 million for OPA, which is about the same amount the agency's been funded at for a while now. It also included language to overhaul pharmacy benefit managers, as well as an increase in community health center funding to $4.6 billion in 2026. And it put a pause on Medicaid disproportionate share hospital cuts, also known as DSH cuts. So the PBM language was pretty similar to provisions contained in Rep. Buddy Carter, a Republican from Georgia's bipartisan-backed PBM Reform Act. It included prohibiting PBM compensation in Medicare Part D from being tied to the manufacturer's list price for a drug, ensuring PBMs provide group health plans and issuers detailed data on prescription drug spending at least semi-annually, and requiring Part D plans to allow pharmacies that meet standardized, quote-unquote, reasonable contract terms to participate in their networks beginning in 2029. So there wasn't a ton in this bill that specifically focused on 340B. Again, there was like one mention, I believe, related to some of this PBM language, which is kind of fairly standard. But what was interesting, and as we noted in our last podcast, there was an accompanied document that sort of looked at some of the conversations that were happening between both parties as they worked on this legislation. And it signaled concerns with HRSA's rebate model pilot. It specifically noted that the pilot could, quote, increase costs for patients or limit access to their prescriptions, end quote. And it directed HRSA to provide a briefing to committees within 30 days of enactment of the legislation about the impact of the pilot program on patients. Given the changes that Will talked about, it'll be interesting to see really what happens with this. But it is, important to note that Congress did raise some concerns about this. And then also in Congress this week, there was another major 340B update involving U.S. Senator Bill Cassidy, who's been a pretty outspoken critic of the program. Will, you wrote the story. What can you tell us about it?
Yeah, so as you said, Senator Cassidy, he's a Republican from Louisiana. He's a physician and has been a pretty vocal critic. He is also the chair of the Senate Help Committee, which has jurisdiction over the 340B program. So pretty influential in 340B legislative matters. And this week, he extended an inquiry investigation to the 340B program that he had been doing for a couple years now, with some pretty tough, hard-hitting questions directed at the 340B prime vendor, which is Apexis. Apexis is under contract with HRSA as the prime vendor for the program. Cassidy had, close to around 50 different questions, and this followed some previous inquiries that Cassidy had made to hospitals, to health centers, to chain pharmacies, as well as a couple of drug manufacturers. So this is the latest iteration of that investigation. It's also important to note that it follows this New York Times investigative piece into Apexis last year that basically accused Apexis of contributing to growth of the 340B program in order to boost its profits, sort of alleged some connections there. We did some reporting there, finding that, critics of the program were pretty quick to jump on that and target Apexis, use that as evidence of the need for more reforms, Cassidy clearly among them, while at the same time a number of providers we spoke to felt that that article was a mischaracterization of Apexis's role and were pretty critical of it as well. So that was sort of out in the open preceding this investigation. So the bottom line in all of this is that Cassidy, there's been a lot of other stuff happening in Congress right now between these huge spending debates. Cassidy also has a really tough primary later this year. He is still pretty locked in and interested in 340B. This investigation shows that he is continuing with some earlier comments he made where he's indicated that, he wants to potentially put forth some 340B legislation or at least be very involved in that debate. And we know now from this newest iteration of his investigation that he is not slowing down there.
Thanks, Will. That was pretty insightful information. And I know that you've been covering several state houses that are considering 340B legislation. And there have also been some new dark money efforts opposing many of those bills. Can you tell us a little bit more about that?
Yeah, I think I'm going to focus on 4 states in particular where there's been some movement, and we're in early February, and most state legislative sessions start at the beginning of the year. Many sessions are also carryovers from 2025 continuations. And so a lot of the activity in state houses is pretty much happening right now. And to start with Illinois, there was a contract pharmacy access bill, a bill that would prohibit drug makers from placing restrictions on contract pharmacies, that unanimously passed the Senate last year in May, but the House never got a full vote on it. And so providers, lawmakers, some patient advocates organized this big rally to urge the House to actually take this bill up. And so at the start of this month, they had a big rally in Chicago, and it was pretty frigid out. And there were over 600 attendees, but there were, the sponsor of the bill, several health center and hospital leaders, several patients as well were all involved in that rally. And we did some coverage of that. So we'll see if, the House heeds those calls in Illinois. And then in Michigan, we recently saw a House committee approve a different contract pharmacy access bill. And that bill is pretty similar to one that passed the Senate in Michigan by a wide margin last year. So it'll be interesting to see, if the two chambers end up both passing a bill, reconciling that, et cetera. The sort of interesting wrinkle here, which we've reported on in the past, is that the Michigan Speaker of the House kind of had this feud with the head of the Michigan Hospital Association. He accused hospitals of crying wolf on every issue, including 340B. There are some dark money ads promoting the speaker's comments. And so, we will see if that feud is kind of squashed and more of a thing of 2025, or if that comes up again as this House bill starts moving through committees there. Then Kansas, which is another pretty interesting case. There was a new 340B reporting bill introduced, basically requiring providers to report, and hospitals specifically, to report some pretty detailed financial information about their 340B programs. And this bill was introduced at the same time as the legislature is also considering a contract pharmacy access bill. That bill pretty overwhelmingly passed the Kansas Senate last year. Kansas also has a 2-year session, and so it's in the House right now, but there hasn't really been much movement. We've heard some providers have told us that the Kansas House Speaker is pretty opposed to the bill, and so has been kind of holding it tight and not really letting much movement happen. So it's pretty interesting now that we have this House bill that's a contract pharmacy bill that already passed the Senate, and now we also have a new House bill that's a 340B reporting bill. So which one of those bills is going to gain the most traction? Will they ultimately combine? Will they compete? Could they both be passed? That's something else we're going to be really closely following. And then finally, before we wrap up, probably one of the most interesting state cases I would say of all we've been covering is in Virginia. And in Virginia, a lawmaker introduced a contract pharmacy bill prohibiting drug makers from limiting the distribution of 340B drugs to covered entities and their contract pharmacies in the state. And that bill recently was approved by a Virginia Senate committee along party lines. Democrats on the committee voted for it. All the Republicans on the committee abstained from voting. And why this is pretty interesting is that almost 2 years ago, the former governor of Virginia, Glenn Youngkin, who is a Republican, he vetoed a contract pharmacy access bill that had pretty overwhelmingly passed both chambers. And this was after there was some dark money ads that was amplified in some local conservative media coverage, basically encouraging him and pressuring him to veto the bill. We don't know what exactly led him to veto it. He did mention concerns about transparency in his ultimate statement about it, but that was certainly happening in the background. Now, Virginia is very different 2 years now in many ways. First of all, the new governor, Abigail Spanberger, who sworn into office just a couple weeks ago, she's a Democrat, and she used to be in U.S. Congress, where she was a pretty big advocate of the 340B program. The other thing, though, that's pretty different is drug manufacturers have pledged to build some pretty substantial new facilities in the state. So there are a lot of agreements that happened towards the end of last year. AstraZeneca, Merck, and one other all basically agreed to make some pretty significant investments in the state. So you would imagine that that comes with a little more lobbying clout as well in the state house. So that's something else that we're following. And as this bill is moving forward, we've seen some new dark money ads emerge. And these groups are much more targeted at left-leaning voters, it appears. We did some work and found that this one group called People Over Profits, that didn't really have any footprint anywhere or information about its donors or mission or anything, made a pretty massive ad buy in the Richmond area, Richmond being the capital of Virginia, putting ads encouraging, Spanberger to, quote, stop 340B expansion. Those are running on MS Now and CNN. And then there's another group that recently hired a lobbyist in Virginia, and that's put out some flyers opposing the 340B contract pharmacy bill. We also found a pretty interesting connection between this lobbyist and a much larger Washington, D.C. based healthcare advocacy group that's generally been left-leaning in its healthcare advocacy, but includes Novo Nordisk and pharma on its board. So that was sort of an interesting connection there. And we are going to continue to dig into all of these efforts to oppose state 340B bills, as well as efforts to support them and keep all of our listeners and readers really up to date on everything happening there.
Well, that's interesting, Will. As a Virginia resident, I can say personally, a number of my friends reach out to me when they started getting texts about this terrible 340B program and how they need to stop this bill from moving forward. I thought it was pretty interesting because I heard not only from a lot of my more progressive friends, but also from some conservative friends. Everyone seemed to be getting texts with a little bit different messaging, but certainly the opponents are doing what they do. But perhaps, as you mentioned, it is a much different environment and landscape in Virginia with Abigail Spanberger being a big fan of the program. And I would not be surprised if they are able to overcome some of this dark money efforts. So I guess we will all stay tuned. I'm sure you'll be reporting on that as well as the rest of the team. I think over the next few months, a lot of our attention will focus on state development since, as many of you know, many of the state legislatures are only in session early in the year. But, Luke and Shannon and will also be really spending a lot of time on Capitol Hill, et cetera, working with their sources because we're finally getting things heated up both in Washington, too, when it comes to 340B. So it's an exciting time to be a reporter or editor in the 340B space. And it should be a very busy year, 2026. Unlike 2025, which is a very calm, cool, mellow time for all of us. Okay, well, good. Well, I think that brings us to the end of today's episode. We'll continue to keep an eye on all things 340B, and we'll be back in 2 weeks with a new episode. Of course, we will report on anything that happens in the meantime on our website. Please follow along with our twice weekly newsletters. And just a final reminder, if you're not a current subscriber, you can take advantage of our 25% discount for first-time subscribers only by going to 340breport.com and clicking the subscribe button and using the discount code podcast25. Thank you for joining us.